So question 6, the use of tamoxifen. He's asking about tamoxifen. The use of tamoxifen for breast cancer can cause all of the following adverse effects. He's asking about adverse effect of tamoxifen, except carcinoma of the contralateral breast. This is, I think, this is not adverse effect. Tamoxifen, it's called selective estrogen receptor modulator. So it has estrogenic effect and anti-estrogenic effect. Estrogenic effect on the endometrium. So it is a risk factor for endometrial hyperplasia and endometrial carcinoma. And this endometrial carcinoma or hyperplasia can lead to vaginal bleeding because it has estrogenic effect on the endometrium. And at the same time, tamoxifen, it has anti-estrogenic effect on the breast. So therefore, it's used for prophylaxis and the treatment of ER, estrogen receptor positive breast cancer. So deep vein thrombosis, this is known side effect of tamoxifen. It has a thromboembolic, it increases the, it can cause hypercoagulable state, this type of medication. So it can cause thromboembolic events like deep vein thrombosis or thrombophlebitis or pulmonary embolism. So this is, or stroke even. So this is the side effect, stroke and deep vein thrombosis. And endometrial carcinoma is a side effect, vaginal bleeding as well, it's a side effect. So here, the most appropriate answer because he's asking about except. So let's move on to question 7. 86-year-old man has arrived with 3-day history of chest cough, worsening shortness of breath, and temperature of 39 degrees Celsius. Let's just X-ray show large right-sided pneumonia. So we are talking about large, extensive right-sided pneumonia. Which one of the following does not form part of sepsis 6 protocol? Sepsis 6 protocol, this is, its measures has to be done in the first hour or within first hour of a patient with suspected severe sepsis or septic shock. So these sepsis 6, you have to give 3 things and you have to take 3 things. You have to give the patient oxygen if the patient is hypoxemic, targeting autosaturation above 94%. You have to give the patient challenge of fluid, crystalloid, usually Hartmann solution or ringer lactate or normal saline. And you have to give a broad spectrum antibiotic based on the local hospital guidelines. 3 things you have to take from the patient. You have to, before giving the antibiotic, you have to take appropriate cultures. The other things, you have to take routine blood tests, including the FBC and chemistry and including serum lactate. And you have to follow up the serum lactate if the lactate level above 2 millimole per liter. And the last thing, you have to measure the urine output and to do follow-up of the urine output. So this is the sepsis 6. So administer empiric antibiotic, this is one of them. Comments appropriate intravenous fluid therapy, this is appropriate. I think this is one of them. Measure serum lactate, this is one of them. Perform chest X-ray, this is wrong. It's not one of the sepsis 6 protocol. Taking blood culture, this is one of them as well. So this is the appropriate answer. I think it is choice D. So let's move on to question number 8. 30-year-old female present to emergency department with 2-day history of right-sided pleuritic. So right-sided pleuritic chest pain. So pleuritic, it is postural, or it is chest pain that change with respiration or with respiratory cycle. So this is pleuritic character of the chest pain. So shortness of breath on exertion, she has shortness of breath on exertion. She is taking oral contraceptive pills. So this is very important in the history. She is on oral contraceptive pills, and you are suspecting that she might have pulmonary embolism. Which of these tests most specific? So he's asking about most specific for pulmonary embolus. Is it EBGs or chest X-ray or CT pulmonary angiogram or D-dimer or VQ scan? The most specific, it is CT pulmonary angiogram. It is CTPA. CTPA. This is the most specific. If he's asking about the first step to start with, the first laboratory test to start with, the D-dimer, usually the first laboratory test we can to start with. If the patient is unstable, the most appropriate to start with it, you have to start with EBGs. If the patient is unstable and hypoxemic, you have to do bedside EBGs, and according to this, you have to make the decision what's the most appropriate next step to do. So here, question 9, 72-year-old lady is brought in by ambulance to the emergency department after waking at 9 a.m. Her husband noticed she had right-sided arm and leg weakness. So here we have acute onset of a neurodeficit, acute onset of neurodeficit, acute onset of a right-sided hemiplegia. This is called a wake-up stroke, or a stroke with unknown onset time. This is called wake-up stroke, or it's called acute stroke with unknown onset time. So she had slurring of speech, and she had left-sided facial drop. So it is a typical picture of stroke, acute stroke. She was last seen well going to bed the night before. So she the last time seen well, it is night before. She is a smoker and on the medication for hypertension and diabetes only. Her ECG sinus rhythm, and you perform CT scan for her brain, which shows signs of ischemic stroke. So she had ischemic stroke. What is the most appropriate acute treatment for this lady? So here, this type of stroke, it's called wake-up stroke, or stroke with unknown onset time. In terms of the management of this type of stroke, it is a bit it's not straightforward, because one thing about the thrombolytic therapy, the therapeutic window, or the window that's used for giving thrombolysis, usually 4.5 for 4.5 hours. So the patient must be presented within 4.5 hours within the onset of the symptoms. So this patient, we don't know what the onset of the symptoms is unknown. Therefore, the giving thrombolysis here, it is not, I think, advised or not recommended for this type of this type of stroke, which is stroke with unknown onset time of the stroke, or it's called wake-up stroke. So thrombolysis, it's incorrect, because most likely we are outside the therapeutic window time, which is the 4.5 hours. So the most appropriate acute treatment in this lady, to give warfarin, this is absolutely contraindicated. Why? Because when you will start the patient on warfarin, the patient will have hypercoagulable state because of the inhibition of protein C or protein S, and this will lead to transient hypercoagulable state. So warfarin is absolutely wrong. Heparin, clopidogrel, or aspirin, the most appropriate acute treatment here to give antiplatelet therapy, and the usual antiplatelet therapy usually we will start with, it's aspirin. So I think the most appropriate acute treatment for this lady is to give her aspirin at this stage. Again, thrombolysis for this type of stroke with unknown onset of the symptoms, it's not recommended, because usually they are outside the therapeutic window, or the time window, which is 4.5 hours after the onset of the symptoms. So here we have question 10. A 18-year-old boy attends your emergency department with a deep wound over the third metacarpophalangeal joint. So it's over metacarpophalangeal joint. This is the metacarpophalangeal joint here in the hand. In the left hand, he tells you he was a fight, and he thinks he cut his hand off the other person too. So it is a human. It looks like a human bite. So which of the following would not form a part of the initial management for this boy? Antibiotic therapy, it's highly recommended for this type of wound. So the patient has wound, and this type of wound, most likely it's dirty wound. So the antibiotic is highly advised and highly recommended. So antibiotic therapy is one of the part. Checking distal neurovascular status, it is the usual trauma for any part of the body, especially for the upper limb and lower limb. We have to check neurovascular status after any trauma patient. So this is one of the part. Checking her tetanus status also, it is one of the part, because if the patient if the patient tetanus vaccine, if the patient is not vaccinated for tetanus, he has to get a tetanus immunoglobulins and tetanus vaccine. If the vaccine was recently in the last few years, I think up to 5 years, we have to give only tetanus immunoglobulins. We don't need to give the vaccine. So checking the tetanus status is very important. Suturing of the wound, this is wrong. Why? Because this wound has to stay open, and we have to close this wound, what is called delayed closure, or secondary closure, it's called, or delayed primary closure. Either it's delayed primary closure, which is after 4 to 5 days, because these type of wound, especially in the side of the joint, in the hands and in the feet, at high risk of development of the infection, and some type of infection, it could be anaerobic infection, and these kind of infection, they are very severe, and the growth of microorganism, if we are closing the wound, it's going to be quicker, and we are if we are closing the wound, we are giving adequate media for these microorganisms to be replicated and to be grow in this media. So suturing of the wound in this kind of wound, it is not recommended. We will suture the wound, but it's later. It's called delayed primary closure. It's called delayed primary closure, usually after 4 to 5 days. So this is D is the most appropriate answer. And X-ray of the affected area, I think it's appropriate to check if there is any signs of fracture, any bony fracture. So this is the question number 10, and I will continue the question, the remaining question in the next video. Thanks for watching this part of the question discussion.